As they say, health is wealth. Without health, there's nothing that you can actually do. About December, first week, second week of December, I was hospitalized, and I couldn't eat for 2 weeks. I couldn't eat, couldn't drink, I couldn't, they had to be feeding me through, through, yes, NG2 and other means. So, if you are not healthy, there's virtually nothing you can do.
Healthcare beyond politics. The Demsa medical outreach. Healthcare is often debated in politics, but for many, it is simply about survival. In Demsa, Adamawa State, access to quality medical care became more than a promise. It became a lifeline. Driven by personal experiences and a deep sense of responsibility, distinguished Senator Binos Dauda Yaroe took healthcare beyond politics, bringing hope, healing, and dignity to thousands. This is the story of compassion in action. This is the Demsa Medical Outreach. Health indeed is wealth. Drawing from personal experience and a deep understanding of what it means to be ill, distinguished Senator Binos Dauda Yaroe brought a life-saving medical outreach to his constituents, an initiative he has held close to his heart since assuming office. The outreach is particularly unique as the senator openly shared his own experience of hospitalization, further strengthening his resolve to make quality healthcare accessible to the people.
As they say, health is wealth. Without health, there's nothing that you can actually do. About December, first week, second week of December, I was hospitalized, and I couldn't eat for 2 weeks. I couldn't eat, couldn't drink, I couldn't, they had to be feeding me through, through, yes, NG2 and other means. So, if you are not healthy, there's virtually nothing you can do. You cannot be productive, you cannot go to farm, you cannot go to market, you cannot go to school, you cannot do anything. So when I went to the Senate in 2019, I considered what one thing can I do that will make an impact in the lives of the people in my constituency at the grassroots level. So I decided that giving them periodic intervention through this free medical health care is what will help. And we have been doing that consistently. Like I said during my remarks, we started here in Demsa in August 2019, and we have gone around all the 9 local governments. This is the 3rd outreach we are doing in Demsa. In some local governments we have done twice. So I just believe that this is one area that you can impact the lives of the ordinary people who have no access to their senator. If you go and ask these people, they don't know where to meet me. They don't know where to reach me. They don't have my telephone number. Even if they have my telephone number, they may call me. I may not be because I see a strange number. But when I do something like this, they all come. They all benefit without any, any showing any partiality. We don't ask people their religion, we don't ask people their political party, we don't ask people their tribe, we don't ask people where even they come from. So it is an intervention that we do that benefits the people at the grassroots. People who perhaps all they need is maybe 10,000 naira to go and be tested and be given drugs that will help their case. And some people, it is an intervention that will require maybe an operation. One patient said that had been operated, he said they were referred to Gombe and they told them to pay 500,000 naira. They don't have the money. And then all of a sudden they found that we are doing this activation. They came and they got their operation for free. So it is something that has impact in the lives of the ordinary people.
The medical outreach commenced on Wednesday, 5th February 2026 at the Cottage Hospital, Demsa, in Demsa local government area of Adamawa State. The program attracted beneficiaries not only from across the constituency, but also from neighboring states. Its wide reach and impact. Addressing the press, Dr. Medan Jama disclosed that the target of the outreach, stating that between 10,000 and 15,000 people were expected to benefit. He confirmed that over 5,000 patients were attended to on the first day alone.
Actually, let me start with the target population. We were estimating to cover at least about 10 to 15,000 people in this particular medical outreach. These 10,000 to 15,000 people that are going to benefit, let me say it, as of yesterday, we distributed over 5,000 cards and we exhausted them. Today, we have distributed less. I don't know what happened. We distributed 4,000 cards today, and you can see people have been cleared. So we are waiting for what we are going to see tomorrow, and that is to tell you we are almost hitting the target.
Dr. Jama further explains the categories of illnesses and medical conditions covered under the outreach.
Like everybody has spoken earlier, we have some target of ailments that we want to cover, particularly minor surgeries like herniorrhaphy, excision biopsies, appendectomies. In fact, because Professor is here and he's good in doing some of these major cases without any complications, he is targeting also to do major cases like thyroidectomies, prostatectomies, and other exploratory laparotomies, because he's a professor in general surgeries and he has done a lot of them as we speak. Then when coming to other side, we have also a consultant gynecologist who is also operating there. He has done a lot of myomectomies, cystectomies, and other cases that needed obs and gynae attention. Then apart from that, we have other treatment of tropical diseases, malaria, typhoid, and other ailments that we know. Then we have, I think we have a family physician also there that is taking care of hypertension and others, diabetes, and other cases. And in fact, we just discovered that there is a lot of cases of scabies and other things here. We are taking care of those ones also.
The second day marked the official flag-off ceremony, which was attended by dignitaries from various walks of life. Prominent among them were the Royal Father, His Royal Majesty Haman Alhamdu Gladstone Teneke, MFR, Tiklobata Bangashi Yeshivato, the Hamabata. The Principal Medical Officer of the Cottage Hospital, Dr. Pongri Haniel Nivanyi, who represented the Adamawa State Commissioner for Health, Chief Felix B. Tangwami, alongside several other notable guests. On the second day, over 4,000 medical forms were distributed and completely exhausted, further underscoring the urgent healthcare needs of the people and the relevance of the intervention. Speaking at the event, the lead surgeon, Professor Michael Misono, commended Senator Binos Dauda Yaroe for his deep passion and commitment to the health and well-being of his constituents. He encouraged the senator to sustain the initiative and called on other political leaders to emulate the gesture, noting that meaningful development thrives on collective responsibility. Professor Misono also praised the executive governor of Adamawa State for the foresight in constructing the cottage hospital and equipping it with 2 ultra-modern scanning machines.
We have a lot of elected officials, and we are praying that God will put in each of them a project that He will pursue. As it is, we are going to finish this outreach and leave a lot of patients unattended to. So if somebody is interested, you can come and do the same. If you go around the whole place, before you know, you will have helped people. I think the most important thing is, if we love our people, we will do what is right for them. Let us stop this politics we are playing. Oh, he should have done this, he should have. One person cannot do everything. Another person can wake up and say, no, my people are suffering from water shortage. I see boreholes all over my constituency. It is allowed. Somebody can decide that, no, let me boost the agricultural production. Give fertilizer to everybody. That is also a community project. Please, let's stop fighting each other unnecessarily. It is not once, it is not twice. He has done this severally. Meaning that this is a project he's passionate about. This is what God has put in his heart to do, and he's doing it. And whether you believe it or not, all this work we're doing, the volunteers, the sponsor, and everything, it is God that permitted it to happen. And whether we like it or not, it's God's work we are doing. So please, whatever work God has put in your heart to do it well. And to our senators, if you are working and nobody is saying something good or bad, it means the work is not good. Please, do not worry yourself. That which God has put in your heart to do, go ahead and do it. Because at the end of the day, when we are all done, we will be accountable to God. What you do with the talents He gave you. So, we do not lack things to do. There are many things to do. That's why if you are confused or you don't have an idea of what to do, please go back to your constituency and ask them. They will tell you what they need most, and they will help. And our royal fathers are always around, and they give a listening ear. They will help us to do and advise on what to do. I'm sure that when we are done speaking, we will go inside to see what is happening. I want to assure all of you, this is the first time I'm coming here. This cottage hospital is well built to standard. I went in there and I saw 2 ultra-modern scanning machines. So, I don't know, you may not know the use of those things, but most of the patients we had to operate, we needed those machines. And that they are available to complement the work we're doing. We're not working in darkness, we're happy. And with this, I say thank you to the governor for this initiative and for doing what we're doing.
In his address, the royal father described the medical outreach as neither the first nor the last of its kind, reiterating the popular adage, health is wealth. He further appreciated His Excellency, Governor Ahmadu Umaru Fintri, for the initiative of constructing and equipping the cottage hospital with modern medical equipment.
Ina matukan farin ciki kwarai da gaske da muka samu wannan zarafi mu zo nan mu gani da ido abinda senator namu yake tallafawa. Na san wannan ba shine na farko ba, kuma ba zai taba zama na karshe ba. ya yi a wasu wurare daban-daban, kuma idan kuka tuna ko a turawa suka ce health is wealth. In ba lafiya ba zuwa gona, ko abincin ma in ba lafiya ba za ka iya ci ba. Saboda haka idan dai arzikin duniyar nan kake so, sai ya zamana kana da lafiyarka. Zan gode ma gwamna Umaru Sintiri da wannan zurfin tunani da ya yi, ya kinkiro wa'annan cottage hospitals har guda 9 a wannan jiha ta. Gashi yau an gaya mana equipment da suke ciki, ko a teaching hospital ma babu, amma ga sunan a tattare kuma ba a amfani da su. Sai a yanzu da shi sanatanmu ya yi tunani cewa bari ya zaga ya kirkiro ƙwararrun mutane waɗanda za su iya amfani da waɗannan kayan, a zo kuma a taimaki al'umma. Kuma kamar yadda ya faɗa, na tabbata mutane za su fi 10,000 waɗanda za su amfana da wannan outreach. Amma addu'a ta shi ne duk kowa da ya zo nan da irin illansa da abin da yake damunsa, Ubangiji Allah ya bashi hutawa.
Also speaking, the Principal Medical Officer of the Cottage Hospital, Dr. Pongri Haniel Mivanyi, representing the Commissioner for Health, expressed profound appreciation to Senator Yaroe for his unwavering drive towards improving healthcare delivery. He noted that the outreach aligns perfectly with the health policies and vision of the Executive Governor of Adamawa State.
It gives me great pleasure to stand before you today on behalf of the Adamawa State Government to witness and formally flag off the free medical outreach here at Cottage Hospital Demsa, an initiative designed to reduce the burden of untreated medical conditions, prevent avoidable complications, and provide specialized healthcare services that are often beyond the financial reach of many of our people. At the outset, I wish to sincerely appreciate and convey the warm greetings of His Excellency, the Executive Governor of Adamawa State, Right Honorable Dr. Ahmadu Fintri, whose administration remains steadfastly committed to improving access to quality, affordable, and equitable health care services for all citizens of the state, irrespective of location or social status. Today's outreach is a practical demonstration of that shared vision. I wish to particularly commend and appreciate the organizer of the noble initiative, distinguished Senator Reverend Binos Dauda Yaroe, for his constituency. This outreach clearly reflects his deep concern for humanity. Free medical outreaches such as this play a critical role in addressing gaps within our communities. They help to identify and manage untreated medical conditions early, prevent avoidable complications and disabilities, and provide essential services to vulnerable populations who may otherwise be unable to afford them. This aligns perfectly with the policy direction of the Adamawa State Ministry of Health and Human Resources, which prioritizes preventive care, early diagnosis, and community-based intervention as key pillars of our health delivery system.
For Senator Binos Dauda Yaroe, The medical outreach represents the fulfillment of a vision conceived upon assuming office, a vision he has consistently sustained in service to his constituents. During the events, the senator also seized the opportunity to clarify public concerns surrounding the controversial electoral bill currently before the National Assembly, offering explanations and setting the records straight.
I can tell you that I'm actually a member of the Senate Committee on Electoral Matters. So I have been part of the process of reviewing the 2022 Electoral Act. We have held numerous retreats, and the Committee of Electoral Matters of Senate has been holding joint meeting with the Committee of the House of Reps. So we have met in Abuja, we have met in Lagos, we have met, we have held various retreats to work on it. And I can tell you that in all the work we have done, the joint committees of the two chambers, we have recommended electronic transmission of results. And that is what is in the final report of the Senate Committee.
Following the official flag-off, Senator Yaroe, alongside invited guests and medical consultants, embarked on an inspection tour of the facility to assess ongoing medical procedures and general operations of the outreach. Beneficiaries of the program, one after another, expressed heartfelt gratitude to the senator. They shared personal testimonies of how they heard about the outreach, came with hope, and received quality medical care without paying a dime.
Dika mai lokacin na zo Demsa na zo samu jinya kuma ina yi. Na kawo musu damuwa hawan jini da ulcer da hepatitis na C da typhoid. Na samu maganin kuma. Ya fi shekara 5 ma wuri na. Ina zuwa asibiti ba kaman ma hawan jini da ulcer ba. Na ta faman jinyan shi. Ba karbi naira wuri na ba amma an yi jinya na.
Ni na ji labari cewa ana aiki a nan Demsa Binos Senator ya yi odarin akan cewa duk marasa lafiya su zo nan. Duk wanda ya zo nan da yardan Allah za a yi mashi aiki a sawage, ya tafi kuma a sawage. Shi ne muka ji labari sai yayana ya kira ni, mun taso daga kauye a karkashin Numan Federation. Sai muka zo nan, gashi nan Allah ya sa mun samu lafiya.
Wannan babana ne. Ya zo bai da lafiya ne, so an zo an mishi aiki. Abun ya jima mishi tun yana shekara 20 da.
Sun ce Allah masa albarka da abubuwan da ya yi, gaskiya ba da sauki ba, amma za mu ce masa Allah ya ba sa baninki da abubuwan da ya yi. Gaskiya taimaka ma talakawa ga waɗanda ba su da kuɗi, ba su da karfi yi, amma babu da za mu ce masa sai da mu ce masa mun gode.
Da farko ina gode wa Allah mai girma da ɗaukaka da ya kawo mu wannan lokaci har muka samu irin wannan ayyuka da wannan sanata namu ya taimaka mana Binos Yaroe. Muna fatan Allah ya saka masa da alkhairi, kuma gaskiya mun ji daɗin wannan aiki da aka yi mana. Dan domin shin wannan ido nawa yana samu matsala kusan zai kai kamar shekara 5. Kullum ina kokarin zan je asibiti, Allah bai bani daman naje ba saboda irin matsalolin da suke faruwa. Sannan bayan haka na dan bincika, na ji aikin asibiti nan zai kai 70,000 banda kudin mota da ainihin magungunan da za mu siya. To sai wannan bawan Allah Binos Yaroe, Allah ya taimake shi kuma ya taimaka wa talakawansu da su so ai musu irin wannan aiki kyauta. To muna fatan Allah ya biya shi kuma Allah ya tsare masa kujeransa.
Gaskiya na ɗauki shekara 4 da matsalan ido nan, ba na gani kwata-kwata. Ba ni da kuɗi babana wanda zai je wani asibiti. Ban taɓa zuwa wani asibiti ba da taimakon Allah, sai nan ne farkon zuwa. Lokacin da Binos ya fara zuwa a can mission, to kamije ya riga ya gama aiki an wase. Daga lokacin da na je magunguna ne ake bani wani saya. Kuɗin da zan ɗauka na yi noma, ɗaukan je asibiti a duba man ba abinci a gida. Har sai da taimakon Allah yau da na ji labarin Binos ya zo. A gaskiya ban sa samani har ido na zai zo har kalle ka a tsayawanka ba.
Yanzu kina gani kenan?
Na gani babana, har na gani ko ina ga ido na gani ko ina.
The senator later attended the closing ceremony of the outreach on the 7th of February 2026, where he went round the facility with guests, greeting patients who responded with loud applauses in appreciation of his benevolence. Speaking to the press afterwards, the distinguished expressed satisfaction with the success of the program, stating that he was overwhelmed by the testimonies and experiences shared by the beneficiaries.
We have observed and we give the glory to God is that this intervention has been very, very successful. I've gone around, I've seen many patients that have been operated upon, and both men, women, and children. And everywhere we go, people are just expressing their gratitude for the intervention we have done. And I was telling them the story I read on Facebook concerning the patients that came here. One of our daughters met with a classmate that they have not seen for a very long time in a shop, and then she saw a growth in her neck, and she said, why? She said she has been trying to get it operated on, but she didn't have money. So she now told her about this outreach, and the lady came here and she was operated upon. It was successful. And the husband, when he heard, he was praising God. So those are the stories we hear, and we are really happy that we have achieved the purpose for which this intervention was organized.
Sharing in the excitement, the lead surgeon of the outreach, Professor Medcal, a professor of general surgery from the University of Jos Teaching Hospital, echoed similar sentiments, expressing joy over the positive impact of the program on the lives of the beneficiaries.
For almost every outreach you partake in, you will see this category of patients that you yourself, you go home and sleep and you're happy that if I had not come, perhaps this man would not have gotten, this patient would not have gotten this intervention. You see manners of sicknesses and you wonder, where have they been? Where have they been keeping them? And when you hear their stories, you will know that, Kai, we have not started yet. People go, get their assessments, they're ready to be operated, no money. They just go back to their villages and sit quietly. So when they hear about a free medical outreach, that is when they all come out. So for those special group of patients that could not afford care, that were seemingly neglected, I feel very happy at every outreach that I came and were able to touch their lives.
The Demsa Medical Outreach 2026 remains a brainchild of Senator Binos Dauda Yaroe and stands as a clear demonstration of his enduring commitment to the welfare, health, and dignity of his constituents.